This video will help you understand the different concentrations that CityVision offers in our Masters in Addiction Counseling and which one might be the best fit, and also discusses some of the trade-offs between pursuing a Masters in Addiction Counseling and a longer Master's program that might lead directly to an LPC or Licensed Professional Counselor degree. So CityVision's Addiction Counseling program paths, we offer addiction counseling at 5 different levels. So there's an addiction counseling undergrad certificate, and then that can build towards an addiction counseling associate's, and then that can build towards an addiction counseling bachelor's. That then can go towards a graduate certificate and addiction counseling master's. Now, the way this works with a lot of the different certifications out there, so SAMHSA, which is the main addiction counseling federal government organization in the United States, has standards, and they have a career ladder. And at the first 2 levels, our undergraduate certificate and our associates will help you get to the peer specialist and addiction counselor certification, the educational components, and sometimes the practical components. Now, you also have to take a test, and you'll need to also get supervised experience. Then our bachelor's is really focused on the Certified Addiction Counselor 2 certification, and our graduate programs, now these are the different concentrations. So if you're very interested in becoming a master addiction counselor or a clinical addiction counseling supervisor, then I would encourage you to look at our clinical addiction counseling concentration. Then the other option, though, is if you decide you want to use this as a path to an LPC, we've designed our program to align with Liberty's 60 credit master's program in clinical mental health counseling. And we've aligned it with the goal of having up to 27 transfer credits to Liberty. So we have links that explain the details of that, and I'll cover that in a little more detail. So in summary, if you do not plan to pursue a licensed professional counselor, but you want a master addiction counselor, or to be a supervisor or both an addiction counseling supervisor, then you should choose the clinical addiction counseling concentration. If you're not interested in either an LPC or a MAC and primarily just want to use the training for a recovery ministry context, then that's the Christian Recovery Ministry concentration. If you plan to pursue an LPC after this master's and would like to transfer to Liberty University, then that's what the pre-LPC concentration is for. So part of what I want to explain also is the trade-offs between a master's in addiction counseling and other paths. So if you look at these different paths that you have, so you have the peer support specialist. So this is part of SAMHSA's career ladder. Some people will get that, and some people will go directly to become a certified addiction counselor 1, and usually that's a path to become a certified addiction counselor 2. For a lot of organizations, a certified addiction counselor 2 gets better pay and can do more things. And then the next tier really is the master addiction counselor program. Often that's a 36 or 48 credit master's. But one of the things you really need to understand is these 3 other masters, so a licensed professional counselor, the licensed mental or marriage and family family therapist, or a master's in clinical social work will lead to a licensed clinical social worker. Most states require one of these licensures for billing, insurance, and Medicaid. So what that really means to you is often these jobs get paid a lot better than the master addiction counselor, and there's more marketable. So there's a lot, more pay. So what we recommend for a lot of people, I think a master addiction counselor and a master's in addiction counseling is a good step to an LPC. So part of the other reason for understanding that is often if you have a licensed treatment center, you're going to have a chief medical officer, usually that's over everything. And then you'll have licensed professional counselors. You'll have master addiction counselors or clinical supervisors, addiction clinical supervisors, licensed clinical social work, and clinical sociologists. Now, while I'm showing these at the same level, in some organizations there's one big thing that's notable is in a lot of states in the United States, the master addiction counselor can't be billable to insurance or to Medicaid, and in some states, there's some other limitations on that. So, and often these will be the ones that supervise the LDACs, the licensed addiction counselors. So, coming back to the pre-LPC path, and we think that a lot of our students will go down the pre-LPC path. Why would you choose to go down City Vision's pre-LPC path versus directly to Liberty? Well, number one reason is because we do addiction counseling. We believe we have more addiction counseling courses than any other Christian university that we're aware of. Both if you count our undergrad and graduate level courses. We've designed our master's courses to align with KCREP standards. That's the main LPC standard organization. So we're not KCREP accredited, but we align them with KCREP standards to maximize transferability. But all of our courses have a very strong focus specifically on addiction counseling applications for every course. The other reason is just affordability. So if you go directly to Liberty and you pay their hourly tuition rate, the tuition would be $37,700. Over 3/4 of our students usually go through partner ministries. So with that discount, if you go through City Vision's path, it would cost $26,235, and that's doing Liberty, doing City Vision's masters and then Liberty's masters. And the other reason to do it is a lot of students may want to get an intermediate credential. They say it's going to take a long time to get them become an LPC, so they want to become a master addiction counselor or addiction counseling supervisor while still pursuing an LPC. Now, if you decide to do that option, it may require more combined credits shown on the map. In particular, a lot of those options will require that you take City Vision's practicum course, which won't transfer to Liberty. Now, one thing to make note is we do not recommend City Vision's pre-LPC track with schools other than Liberty. The reason for that, and we explain this in our frequently asked questions, but the reason for that is most schools will only accept up to 25% of the transfer credits or less. And a lot of state schools just don't accept transfer credits from a lot of Christian schools like City Vision. So our pre-LPC track is really a path to Liberty. There may be a few other schools, but you would want to investigate the transferability there. We have done the mapping with Liberty and looked very carefully. Whenever we designed our courses, we compared what we were doing in our syllabi. And you can see in this mapping, you can look at which of our courses, the ones that are in bold are the ones that we believe have the best chance to transfer to Liberty. So we don't guarantee transfer to Liberty, but we've designed our courses to be optimized for transferability in their program. We're following the same KCREP standards where we've designed them to be 80% similar or more. In most cases, we're either using the same books or books that are meeting the same KCREP standards by maybe a slightly different vendor. And we try to make it obvious which courses here. So either we're not offering, in these rows, we're not offering these courses, or if we're offering courses like our skills course, these other courses, they make it clear that they're not going to accept those for transfer. So hopefully this is helpful. If you have questions, please ask people in our admissions office and fill out the form above. Thanks a lot.